Vina, and this is the Society for the Study of Pain SSPN webinar series. The topic for today is opioids in animal pain management, and it will be delivered by Professor Emanuela A.O. Shogebi. I'm sorry. She will help us to correct the correct pronunciation. Professor Emanuela Olubanke Shogebi is of the Department of Veterinary Surgery and Theriogenology, Federal University of Agriculture, Abeokuta. She has broad hands-on practical experience in teaching, training, and research in veterinary medicine of about 18 years. She was born in Lagos and hails from Obafemi Owode local government in Ogun State, Nigeria. She attended Victory High School, Ikeja, between 1980 and 1985, and she proceeded to the University of Ibadan, Oyo State, and obtained Doctor of Veterinary Medicine in 1995. She also obtained a Master of Veterinary Science degree in the same institution in 2007. She later proceeded to the Federal University of Agriculture, Abeokuta, where she obtained a Doctor of Philosophy in Veterinary Anesthesiology in 2014. Professor Shogebi has attended a number of continued professional development courses in veterinary anesthesia and pain management in the United Kingdom, the United States of America, among others. She has held various administrative positions in FUNAB. Her research interest is in the area of veterinary anesthesia, intensive care, and pain management, where she has over 33 published articles in both local and foreign journals and 6 edited conference proceedings. She has supervised over 5 postgraduate students at master's and PhD levels. She's a registered member of professional bodies, including Veterinary Council of Nigeria, Association of Veterinary Anesthetists, International Veterinary Emergency and Critical Care Society, among others. Professor Shogebi is also a member of the Board of Directors at International Veterinary Academy of Pain Management. She's married with children. Her hobbies are millinery, baking, and beading. Ladies and gentlemen, please welcome with me Professor Shogebi as she presents on opioids in animal pain management. Thank you very much, ma'am.
Thank you very much for that. I'm really very grateful. Yeah, so this evening, like we have heard, I'll be talking to us on opioid in animal pain management. We will be looking at this topic under the following objectives: perhaps to understand the pharmacology of opioids across species, want to discuss the clinical indications for opioid use in animal, the routes of administration and dosage concentration, and we'll be looking at the brief benefit and risk that is associated with opioid therapy. Then we'll need to understand some specific species consideration. Opioids, as we know, are compounds that structurally relate to products found in opium. Examples of opiates are morphine, codeine, meperidine, and opioids are agents with functional and structural pharmacological properties. That's regardless of their structures of opiates, e.g. the endogenous opioids, that's endorphin, fentanyl, and co. Yeah, pain is defined as unpleasant sensory and emotional experience that is associated with a resembling that associated with actual or potential tissue damage. And that's a universal, that definition is accredited to International Association of Study of Pain. management of pain in animals. Now we briefly look at the pharmacology of opioids across species of animals. I am not going to say that I'm an expert in pharmacology as such. That's another area in itself. But I think I just know enough to be able to explain how opioids are used in animals, their effects, and that stuff. So I might not be going too deep into pharmacology right now. Like I said, I just a little of it to make us understand how we navigate opioid use in animal pain management. And so we have we have about 4 classes of opioid. That's full agonist, partial agonist, like we have in buprenorphine. We have agonist, antagonist, that's we have with butorphanol, pentazocine. Then we have the antagonist itself. Well, in animals, we have 3 different types of opioid receptors that is shown to have on equivalently to mediate pain in animals. We have the mu, we have the delta, we have the kappa. So all these 3 receptors in opioids, they all share the same pathway. So implication of that, like they will mediate pain along the same pathway in the body system. These receptors are located throughout the brain and the spinal cord. They are found in neurons of tissues of vertebrate species of animals. And pain receptors are referred to as nociceptors, which are grouped. These nociceptors are group of sensory neurons which specialize with specialized nerve endings widely distributed in the skin, the deep tissues. Deep tissues include the muscles and the joints and most of the visceral organs. Right. Pain signals are transmitted via either the myelinated axon of the A group or unmyelinated C fibers to the dorsal horns of the spinal cord. Now, this activation of fibers results in a release of the sensory neurotransmitter substance P, then the excitatory neurotransmitter glutamate, and neurotrophic factors in the spinal cord. And so with all of that, we are able to transmit, the pain sensation is transmitted through the system. And you can see here we have the transduction, we have transmission. It is modulated at the spinal cord area, all right? And then there's perception in the brain. This is how it works with the animals. And I'm sure that is not too far fresh from what happens in the human beings as well. All right, so we talk about the effects of the opioid in the system. These are the general effects of opioids in animal species. However, the most common effect can be divided into 2. Some happen at the peripheral, for instance, constipation, uterine retention, bronchospasm, while some also happen at the central level, and that's nausea, sedation, respiratory depression, hypotension, and cough suppression. And I'm sure that some of this you'll find also happening in human beings as well. All right, so the clinical implications of we want to talk about the benefits of pain. We use pain for prevention and relief from suffering. They treat acute pain, such as pain associated with surgery or medical procedures. And then it's beneficial for the treatment of chronic pain that's lasting more than 3 months. It's cases like in cancer. Then we use that to reduce pain in palliative or end-life care. In end-life care, in veterinary medicine, sometimes you want to manage the patient for some time. I mean, at least for a period, to allow the pet owner, pet father, pet mother to get used to the fact that very soon, it's like a preparatory period for the pet owner, that very soon the pet will no longer be with you. And as much as possible, you want to make sure that the pain at this time is being well tolerated. You bring it down to as much as a tolerable level in the patient. So we also use opioid for things like this in veterinary medicine. All right, so still talking about the risk of using opioids in veterinary medicine. These are some of the problems that we have when opioids are used in veterinary medicine. And of course, this is just, it's an individual thing. It's not in all cases that you have either or some of this in patients when they are used. So of course, this is all about the individual differences that we have in patients' responses to administration of drugs. All right, so the clinical indication for opioid use in veterinary medicine. Despite some well-known adverse effects and disadvantages, opioids are still the most effective analgesic available for the systemic treatment of acute pain in many species of animal. And so the question is, do we have do animals feel pain? There are some beliefs regarding animals and pain, and these beliefs are, do animals feel pain, or they feel pain less than humans, or pain is beneficial to rest, healing, and recovery. And then animals tolerate pain better than humans. Of course, these are not true. In fact, in some cases, the reverse is the case. However, we have evidences that animals go through pain. And there are two different kinds of pain. We have the acute pain, which is usually less than 3 months. And these are pains associated with procedures, surgical and medical procedures in animals. And we also have a chronic pain, which lasts longer than 3 to 6 months. And these are pains that they're usually classified as chronic because they've lasted for more than 3 to 6 months after the disappearance of the potential painful stimulus. Pain causes behavioral, anatomical, autonomic, and neuroendocrine changes in animals. I dare to say that also in human, it produces negative affective state, and a common cause of animal welfare concern or compromise in patient. For instance, pain can cause tachycardia, it can cause hypertension, it can result into hypotension, reduce food consumption, resulting in average daily weight loss, and of course, aggression. Yeah, failure to adequately manage pain is a significant cause of suffering in animals, both companion and farm animals. All right, so with this, we know that we are sure, and we have found out that animals do, of course, experience pain. And of course, the pathway, like I said earlier on, is quite similar to that of human being. Now, pain assessment and recognition. For pain to be effectively treated in animal patient, remember that this species cannot talk. You just have to know what and where it is going wrong with them. And so to treat pain in this species of animal, you really have to be able to recognize and assess pain effectively. And so to be able to do this, because they don't talk and they can't really tell you what exactly it is, but you really have to find out, at least for the purpose of having effective pain management in this set of species. A few things like pain scoring system has been validated in this species of animals to assess pain when you are able to recognize pain very well in this species. And so we have this preemptive scoring system. Preemptive scoring system is medication based on the knowledge of the severity of pain that is involved in a particular procedure, right? So we have, you have to be able to try and have a good knowledge, a good hands-on knowledge of what the kind of pain that you're expecting in a minor procedure, in a moderate surgery, in a major surgical procedure. And so you, based on your knowledge of the kind of the intensity, the severity of the pain that you're going to likely inflict on the patient, based on what you want to do, you would have to give the appropriate medication. Then we have the visual analog. It's just an estimate of ongoing pain in patients, and it's on the scale of 0 to 100, and you're using patients based on no pain, moderate pain, and then worse pain. Of course, when you say no pain, the patient is alert, is active, is interactive, and is able to perform some kind of work. But when you say is moderate, then there's some kind of uneasiness, right? You have the reduced activities, is less active, and probably refuse to do any work, because these guys that we talk about here, they're able to express themselves really. So it's just for you to be able to understand what the kind of expression they're giving out is. And that helps a lot to put your pain assessment in the right perspective to be able to treat effectively. And so when we talk about the worst scale, it's about depression, is trembling, is acting so abnormal, is rolling on the floor, there's thrashing and all of that. So you will know, okay, this guy is actually in severe pain, right? So there's also this simple descriptive scale. Okay, so this is also based on estimation of an ongoing pain state on the scale of 0 to 3. All right, so this is based, this is actually based on observation of the animal. So that there's really there's no procedure ongoing, but this guy is not just happy. So maybe we should just talk about the emotional state. So it's not like there's a procedure actually, but there's an that I look at, is not looking happy. Maybe it's rather quiet. Okay, so you assume that there's no pain, but sometimes it could be just making some intermittent noise, right? So intermittent noise, you want to try and speak gentle words, and it's not responding. Of course, that shows that it's in pain. And 3, it's just there and it's just crying and wailing away. This is this is an unusual character in animals. So that tells you that something is obviously wrong. Numerical rating scale, that is also is used to assess pain of procedures. But this time around, we're just looking at some basic variations in the animal. So you look at things like the heart rate, is it comfortable? You look at the ventilation, is it normal? You look at response to stimuli, and that tells you if it's actually responding to, is it actually having pains or not, right? So, and then the Glasgow Composite Pain Scale, it's a much comprehensive one, and it's used both for surgical and non-surgical pain management. And the latest of them all, which is what we use mostly now in veterinary medicine, is the Grimace Facial Scale, right? So you can see, I don't know if you can see this, the faces we have here. This green shows no pain at all. This lemon shows mild pain. And then we have moderate pain, yellow. We have severe pain, orange. And then very severe pain, a bit reddish. I'm not sure what color to put to this. And then worse pain. And you can see the faces in this description of pain, the positioning of the mouth. It's most prominent in here. This is a general one. And then that tells us how much pain the patient is going through, and which will give us an idea of the kind of medications that the kind of opioids that's going to be used, the volume, the dosage, and we look at how are the routes of administration. Other ways that we can probably use to assess pain in this particular species, it's looking at their behavioral pattern. They have a particular way they will normally behave when they're in their top form. And so you want to look at look out for any behavioral changes, and that's things like vocalization, facial expression. Like you said, it's what we now use mostly because it has been validated in almost all the species that we encounter regularly. Then we have self-awareness, activity level, attitude of the patient. We have look at the locomotion, we have the posture. That's what we call the gait. Then the reduce grooming, because they have a way of doing the grooming themselves. And so they do regularly. So if they don't do that as often as they're used to doing it, then you begin to suspect. And then there's another way we look at assess pain in them is the physiological signs, right? You have the neurological, we have the cardiovascular, we have pulmonary, we have musculoskeletal system, we use the urinary system, we use the immune system, of course, the endocrine and the metabolic signs, and we have some miscellaneous signs that we look at. So if you're talking about gaits in this patient, the first dog there, the first dog here, unfortunately, none of these three are normal dog. Each of them are going through some kind of pain, and so you can see the back leg. Let me use the right terminology here. The hind limb of this dog it's not standing well. It's trying to protect. It's trying to use some gate system to adapt to what is going through right now. The front limb too is not holding it the way it's meant to. So this is some level of pain. The second one, the one in B, the way it's lying down like this way is because it's having some pain. And so he's trying to use the posture to mask the pain as much as possible, trying to see the best position ever to take to make sure that the pain is reduced. You can see that this guy is not looking happy. It's towards the wall. That's an attitude. And the guy, the last one, is obviously having a GIT issue. And so standing with an arc like that shows that the pain is there in the GIT. And so they actually do feel pain. And so the level of pain here is at the prerogative of the anesthetist or the caregiver to be able to say this is the level of pain by using the scoring system to say, okay, this is the level of pain, and that would give an idea of the kind of medications to give. Because this is something similar to the dog that I showed earlier on. We can see that they have some level of abnormality in their posture, the positioning of the eye, the face, the attitude, and that's the positioning in number D. That shows us that there is some level of pain in this patient. Look at this. These are horses, right? So the A guy is having what we call colic. That's tympani. It's an abdominal condition and could be very, very painful. And so you can see it rolling. The one in C, it's also having some level of abdominal discomfort, but not as bad as the one in A. Although they're both having the same kind of problem, pain issues, but you can see the severity in A. It's much more than that we have in C. And so you want to, these guys are going to have different kind of opioids at different doses based on what they're going through. Now for farm animals, we look at their orbit. Look at the first one is not having any pains at all, so you can see the eye clearly. While the number one is having moderate pain, and you can look at the countenance of number two, that is in severe pain. And so you can see that the level of tightening of the orbit differs in this set of people, set of sheep. The hair and the head positioning, it's another way you use to assess pain in this patient. Now look at the Fleming. We call this Fleming. If you look at the one going through moderate pain, you can see the teeth is out, but the one going through severe pain, you can see the tongue is also out, in addition to the fact that it's already gaping the mouth. And so it's bringing out the tongue. That shows that, oh, there's a pain. It's in pain somehow. So you have to try and see, scale this level of pain to be able to address the issue properly, right? So this laboratory animals, and then you can see that they also have there's all the last two we're using the facial the Grimace facial scale to assess the level of pain that they're going through. But in all of this, you need to, for you to make this an effective one, you really need to know the normal free state of these animals to be able to say, oh yes, this is not looking good. This is not where the orbit is supposed to be. The whiskers is lowered. The whiskers is shrinking. The whiskers is whatever. The air positioning is not correct. And so this you have in cattle. Cattle is the same thing. If you look at the facial expression in this cattle, you'll be able to tell by now which of them is going through pain and what level of pain they're going through. And so we will talk about, having known the level of pain that they're going through, we want to also look at the route of administration and the dosage concentration in each of these patient. The route of administration, it depends solely on the need of the patient. It could be IM, it could be IV, well, subcute, if you're talking about patches and intradermal. The doses is considered based on the procedure to be taken. The health status of the patient is very, very important. And then the weight of the patient as at the time of consideration is also very important, because the weight, the dosage in this species, in animals, are based on they're usually based on their body weight. It's the drugs is always based on their body weight. And so you want to be sure of their body weight before you start thinking of the dose volume to use. You consider the concentration of the drug, which I know is done in human medicine, but I know that in veterinary medicine, it's not like neonates, infant, adult. We consider here the weight of the patient to be able to do the dosage. Now, apart from that, when you say with the health status of the patient also matters when we consider as part of the things that we consider during the dosage. We look at, is this guy hypertensive? Is it already hypertensive? Is it an obese patient? Or is there any other underlying problems that the patient has before we start thinking about the dosage? And the cost of course, the choice of opioid to use is governed by the severity of the pain that is at hand at that moment. And so that will tell us the severity of the pain, the procedures to be taken, the health status of the patient would guide us through the route of administration and the dosage to be given at a particular time. So the species consideration in veterinary medicine as regards pain management in pain management in animals using opioid, it's a thing of great concern to veterinarians, and the World Small Animal Veterinary Association had this committee that it's looked into. It's a Global Pain Committee. So they have raised global awareness and to provide a call to action based on the understanding that all animals are sentient, and therefore they can feel pain. They are able to feel pain. They go through emotional pain. They go through psychological pain as well. And with that, we all hands are on deck to be able to recognize, pain, and be able to manage this in animals, small animals, farm animals, extensively, so that we improve animal welfare. We also improve even food intake as regards the farm animals. These are a few of my references. And thank you very much for your listening attention. And I'll be ready to take any questions now. Thank you. There's nobody here.
Hello, we can hear you.
Yeah, I'm done.
Oh, thank you. Thank you. Okay. Thank you very much, Professor Sigurd. The floor is open to all of us so that we can make our contributions. Any suggestions, any questions, comments? Thank you very much. Let me. Okay, so let me read from the start, and then Dr. Akinwale will take it from there. Is sweating part of animal reaction to pain? If yes, how do I know if my pet is sweating?
Please, can you take that again?
Is sweating a sign of pain in animals?
Sweating.
And yes, sweat. Yes, sweating. Sweating, bringing out water out of the body. Sweating.
Sweating, okay. Well, sorry, so what about sweating now? What did you say about sweating?
Person is asking whether sweating is a sign of pain in animals.
Right. Yeah, but how are you going to know if the animal is sweating? That's the question. How are you going to know if the animal is sweating? You know their conformation, they're full of folds and all of that. And so it's going to be very difficult for you to know that they're sweating. Like the Yoruba adage, adìẹ ńlá ìyá rẹ̀ ni ò jẹ́ ká rí. And so, I mean, it's not sweating in animal. It's not something that you can see. So you don't want to use that as a yardstick for assessing pain in animal patient. I hope that answers that question right, please.
Thank you. Dr. Akinwale has a question.
Yeah. Good evening, everybody. Can you hear me?
Good evening.
Yeah. Thank you, Professor Sugabi, for this beautiful lecture. In fact, I've learned a lot being a pain management in human being myself. I never knew that pain transmission also is the same in animal as in human beings. So thank you so much for enlightening us. Well, I have some questions now.
Please go ahead.
My first one is, please, when animal is hungry, they can be aggressive also. So how do you differentiate when the animal is hungry and is having pain? When we see animal like dog on our streets, they can be aggressive. And so also, if they are aggressive also, how do you calm them down to give your analgesia? So that's true. Then you talk about route of giving medication. Do you use oral at all for the animals? Because you cannot inject them, you use oral route for medication. Then in fact, when you talk about palliative care and end of life care in animals, because I'm also I also do palliative care in human beings. So in fact, when talk about palliative care in animals, I think it differs from that of human beings, because in human beings,
Excuse me, did you say palliative care?
Yeah, palliative care, end of life care in animals.
Okay.
So I think it's a little bit different from that of human beings, because in animal, you focus more on the owner of the animal, but the human beings, you focus more on the patient and the relation. So I think it's very interesting to know about palliative care in animals. Then I want to know, do animals, okay, you talk about emotional pain and physical pain in animals, but do they also exhibit social pain, like in human beings?
Social pain?
social pain, yes, like in
Okay.
human beings. And lastly, ma, sorry for my question is too much.
No. It's
You
because
say
it's
that,
because you understand it very well. I appreciate that. Thank
okay,
you.
okay. Now my last question is about the drug metabolism in animal. In human beings, we give drugs according as I have said based on weight, and you don't give the same dose to a child. You know, you talk about neonates, adolescents, and adults, and the elderly, because the way drug metabolize in them givers in neonates and children, with the liver is not well matured, the way they handle drug is different. But instead in animals, that you don't depend on whether they are neonates or adults. Can you explain more on that? So thank you very much for this beautiful lecture. I really enjoy it. Thank you, ma'am.
You're most welcome. Okay, so the first question is like how do you differentiate between an hungry dog and
Animal,
an
yeah.
aggressive dog on the street?
Or with pain, having pain. When they're having pain and they're hungry.
The difference to differentiate between an hungry dog and a dog in pain, is that what the question is?
Yes, yes. The first
Great.
question.
Now, the dog on the street, it's aggressive, not because it's hungry, it's because it's not sure of you. The aggression of that dog you see on the street is self-defense, is anxiety, is as a result of anxiety. It's not hungry. Well, maybe now that Nigeria is really whatever, but the dog you see on the street will normally find something to nibble at any time. Go to the trash garbage, pull it down, you will always get something to eat. So what the kind of aggression that you see is not hunger really, it's anxiety. He's not sure of you. And so he has to protect himself. I hope that answers your question. Do we give oral opioids to our patient? It's not safe to give oral drugs, opioids to patient that is in pain because he's not going to be friendly at that time. So we do not do oral. If you're going to do oral, it's because you have given the drug to the owner to take home. And that's at the much later end of the treatment when the dog is, or the cat or the goat is getting a lot better. What we normally do is to give the animal patches with the fentanyl patch. Then there is buprenorphine patch you attach to the patient, and that takes it home until it's back again for a checkup or treatment or whatever, another evaluation to see how far is getting along with the treatment that the patient took home. So we don't usually do oral medications for dogs with opioids. Palliative care. Yeah, so it is interesting for us to know that palliative care, when you talk about palliative care in veterinary medicine, you're talking about palliative care both for the patient and the owner. Because pet lovers feel what their animals go through as well. And so you have to, it's just that the palliative that you give to the owner is just, is not medication. It's some kind of education, kind of, it's going to be fine, uh, just emotional calming you give to the owner. But for the animal, what you're doing is, yes, it's going to, especially when it comes to cancer cases, end of life cases, what you're just trying to do is, for as long as this animal is going to live, it's going to be pain free. And that's what you're doing for the animal. And of course, the owner also knows that whatever you are doing to this animal is just for a little time. And so you want to, at that period, what you're going to do is to make sure that the owner is living with the fact that very soon this animal is not going to be with me anymore. But even then, while he's still alive and I'm still able to relate with it, is not in pain either. And so it's just like one day the patient will just sleep, right? And he's not going to wake up anymore. Sometimes even the owners are there with them. I've seen cases where the owners sleep in the hospitals with the patient, and unfortunately this happened overnight. And so when people were resuming in the morning to take over duty, you just see the owner walk away very quietly. And so they prepare the animal for burial and do the necessary things. And then the owner comes back later to witness the burial. So when you talk about palliative care, end of life care, you're doing it for both the patient to be pain-free and then for the owner to be emotionally stable for this period. Social pain, yes, they do feel social pain as well. And if you're very conversant with people who have dog, especially companion animals, the people on the farm, you might not really notice that, but for people who have companion animals and they are very, very close to them, you'll discover that they do have social pain. When you call it social pain, we call it emotional pain, anxiety pain, right? And so it takes the owner to say, this is what my patient, this is what my dog is going through right now. This is what my rabbit is going through right now. This is what my cat is going through right now. Can you explain what is going on? And then the specialist is just going to say, okay, so did this happen to it? Did this happen to it? Or what happened between now and when did you notice that? It's going to tell you when, and then you try and ask one or two questions, which would lead you to say that, oh yeah, this is an emotional pain, or this is a psychological pain. All right, so maybe or sometimes it's a neurological pain that the patient cannot explain. You see, that's the peculiarity. They are not able to say, oh, I feel this or I feel that. So you have to be able to discern that from all these things that I earlier talked about: their attitude, their gait, and their activity level, and all of that. So these are because these things go down because they have social pain. Like you call it social pain, we call it anxiety pain. Metabolism. Yeah, so I talked about metabolism. Yes, I remember I talked about milligram per kg body weight. But again, we have consideration for what we call them. It depends on the species of animal you're talking about. We call puppies, we say calf, we say kittens, and all of that. Yeah, there's this consideration again. Then there's this consideration that those ones are young and the system is developing right now. It's still under development, and so you want to be careful the dosage that is given to them. The dosage will usually come in ranges. So you want to take the lower dose, the lower range of dose for them to start with, and then you look at the effect. So there's something we call dosing to effect when it comes to that. And so and then when you're doing a dosing to effect, in such cases, you want to be sure that the drug that you're using does not have a ceiling effect. That again, you have to take care of. You have to take into consideration when you do that medication. And then for the geriatrics, in fact, that's why I said the health status of the patient. For the geriatrics, we don't usually go too far with opioids. We don't use the heavy opioids for them because already they're weak. They're not too the system is getting old and they're not too strong, and so you don't want to overload them with heavy opioids and drugs generally, specifically now the opioids. I hope that all of this is able to address all the questions.
Yeah. Thank you so much. I appreciate you.
You are most welcome. Yeah, thank you.
Connected.
Okay, thank you very much. Thank you very much, Professor Chukwuebi. Let me read some questions, and then I will yield the microphone to three people that have their hands up now. Two questions in the chat box. Number one, is there any legal action, law, or prosecution for individuals inflicting pain on animals in Nigeria? That's a question. Number two, how do you get the opioids you use for veterinary anesthesia? Are the opioids same as the ones used for humans? The first question from Adisa David Oluwaseun, and the second question from Dr. Lateju. Please kindly answer those two questions, then we will now allow those who want to ask their questions orally.
Thank you very much for those questions. Legal actions. Now we have the animal welfare body in Nigeria coming up strongly. And we're looking at legal actions are taken not even against people alone, even against if you're found liable not treating your animal pets rightly, even against practitioners. There's this organization that we have in Nigeria. It's called Animal Welfare Protection Agency. It's an agency, something. So they're coming up strongly, and I hope that they will be able to get there. Like, you know, that everything we do here, we're far behind in many things, but of course we're coming up, and we hope to get there where people had started litigations and stuff against practitioners, but we're yet to get to a level where litigations are also mooted against individuals who are not treating animals well under this animal welfare protection agency. Yeah, where do we get opioids from? The opioids that are used are usually human-based. Most of the time are usually human-based. It's common between animals and human. We have fentanyl, we have morphine, we have petidine, we have pentacocin, we have which other one is common around here? Yeah, that's about tramadol. Yeah, tramadol. I am not a fan of tramadol because of the controversies that surrounds tramadol. But some people still use tramadol. We have butorphanol, we have buprenorphine. And so the butorphanol, buprenorphine are animal-based opioids. They're not the full agonist, but they're animal-based drugs, opioids, and some of them are species-based because of the concentration. The concentration for large animal is quite different from the concentration for small animal, and then for some reasons, it doesn't cut across all species. There's some that you do not want to use in food animal for safety reasons. I hope, again, where do we get those ones from? I think my colleague are able to get some around here, like pentacocin, like pentacocin, but I have some senior colleague mentors in human anesthesia. So when I need these other ones, I liaise with them, we collaborate, and they're able to get me some. So I have access to morphine, petidine, I have butorphanol, buprenorphine, and stuff. I hope that answers that question.
Very well. Professor Ogboli, please. Professor Ogboli, one answer, please.
Yeah, good evening, ladies and gentlemen. Good evening. I want to congratulate our speaker, Professor Soge B, for the very brilliant lecture. I can relate with it because over here in ABU, I've worked with our colleagues in the vet faculty and in the vet teaching hospital, and we have co-supervised some masters and PhDs that they did in anesthesia, surgery, vet surgery and anesthesia. So I can relate with it. What I just want to say is a call for action, like maybe to like get more people to be interested in this area of pain management in other non-human species, and to really like get people acquainted with what is happening and what is supposed to be done. Because right now I can see this, I can say for myself from my limited experience that there's very little knowledge about what is happening in that aspect of practice. And also as an animal owner, I used to have some dogs, but I lost some of them and I gave her some of them. That time it was always very difficult to get people to attend to them, especially when you notice that maybe they are in pain or you think that they are suffering something or the other. It's always very difficult. So yeah, kudos to you. Well done. And I think we need to do more to spread the information and to get people involved in this area of practice. Thank you very much. Over and out.
Thank you very much, man. So maybe you help me pass that message to Professor Hassan.
Yeah.
I'm sure you know. I'm sure you know Professor Hassan very well.
Of course.
I'm doing the best I can together with the others in the field to make sure that we expand on pain management as much as possible. Yeah. And I'm not going to forget to say that I'm very, very grateful at this time to International Veterinary Academy of Pain Management, I'm a member and a board member of that association. Of course, the reason why it's a bit slow in getting people to the awareness for pain management, it's again because of the kind of person that we are. We are not ready to change certain policies and stuff. And maybe if this litigation comes up better, stronger, then probably we'll be forced to sit up and then do the needful. But of course, there's machinery in place to make sure that people are doing the right things, but how much of it we're able to get to do now is what the question.
Thank you very much, ma'am. Okay, so because of our time, Stephen Ghana, after Stephen Ghana, Ebere Stephen Sule. Let's start with Stephen Ghana and then Ebere Stephen Sule. Let's make it snappy so that we can manage our time.
Hello, thank you very much for the opportunity. And thank you, Prof, for quite an educative session. You got my attention immediately. Dr. Olumide Dada introduced you from Obafemi Ode, because I think I served in Iro, Obafemi Ode, so I enjoyed connecting with you. Thank you. I'll make it brief. My question is concerning the use of opioids. You said it's one of the common and important analgesics used in animals. Now, on the human side, one of the problems we grapple with, and that usually leads to reluctance or fear of using opioids, is the fear of addiction. So what's the magnitude of the problem in animals? And we know that there are some profiles that raise the red flags in humans when we're talking about addiction to opioids. Usually these are people who have access to the drugs, maybe people working in healthcare, had exposure to pain, and from then they begin to access drugs. So what profiles of animals fits that if it's a problem in animals? And how do I identify an animal that is probably inclined towards addiction? And what are the things that are done to such animals if that problem is identified? Thank you very much.
And so the case of addiction in veterinary medicine, it's not as common as you have it in human medicine. You'll know that these guys they depend solely on human beings to get whatever they want, which makes it different from that of human beings, right? So what we do is, there are some of them that have tendencies for addiction. And, usually when you talk about addiction, it can only come up when you have a chronic case, chronic pain. For acute pain, it doesn't really last for so long, and then that's really. But in the case of chronic pain, what you do is you change over time. You change. Of course, you expect that when you're managing chronic pain, there's a regular assessment of this pain. And so as you do an assessment and you find out that the patient is getting better, you either change the drug or reduce the dosage of the drug. And if if you start a medication and then by your next assessment you don't get a satisfactory result, you automatically change the drug. So the issue of addiction in veterinary medicine is very, very minimal because they cannot control it by themselves. And so you are the one doing the control, and so you're able to put things together properly. I hope that answers the question right.
Yes, thank you so much.
Yeah. And so the last person, please, and then we go. It's our time.
Okay, good evening. Thank you, Prof, for the lecture. Good evening, everyone. So I had a client of mine who presented this case. She said that a Rottweiler of about 4 months, the puppy will always cry all through the night. So she felt that the puppy was in pain. So she brought it for examination, and I checked. I did the physical examination. I couldn't really get anything per se. So I told her, let's observe. She went back home and she said the puppy still cried all through the night. So I really didn't know what to do at that time because with the physical examination, I couldn't really put my hand on anything. The temperature was fine, everything was okay for the puppy. But she said the puppy kept crying. So after 2 days, we lost the puppy. So I don't really know. How will I have done, what would I have done differently since that puppy was in pain? How would I have gone about that particular case? Thank you.
So the puppy has been crying continuously. I said it in the lecture when I delivered it that was a very strange one. Animals would not normally cry all through continuously without stopping. I mean, you try to stroke it, talk to it gently. And so even the physical examination that you did you do a body, apart from taking the physiological parameters, when you took the physiological parameters, did you get a normal result that's in the physical parameters, physiological parameters?
Okay.
The heart rate, the pulse rate,
Yes, everything was normal.
did you do a BP and things like that?
No, I didn't do that.
So asking what you did not do, it's you should have done a thorough physiological examination of the dog, and then do a palpation, do some kind of palpation, look at the limbs, touch the
Yeah,
stomach.
I did this palpation. I thought I asked like a suspecting
did you put the dog at a distance to observe the gait,
Yes.
the attitude,
What
How old is the dog?
4 months old puppy.
Sorry?
4 months. The puppy was 4 months
4
old.
months. 4 months old.
Yes.
And at what time did the owner take it off the parents, or the parents living in the house?
Yes. The parents were living in the house.
Okay, so at PM, did you try to do at that? Did you try to do a PM?
No, I didn't do a PM.
You didn't do a PM.
She
Yeah.
just
So
told
if
me
sorry.
she just said she lost the puppy and they buried it or they thrown it away. So that was just
So because she did not do a PM, we could not rule out anxiety, and we could not rule out internal organ problem. It could be internal organ problem or anxiety in that. It's living with the parents, yes, but then maybe there's a stressor in the house somewhere which you don't know. Right. So if you had done a PM, you would have been able to rule out the fact that there's an internal abnormality going on in the puppy. So this kind of thing it brings out your curiosity, and so you would have next time you just ask the owner to please bring it for you, because for your own good, for your own knowledge sake, you won't even need to, you just say bring it and then assure them that you will give it a proper burial, but let them know that you want to do a PM, that it's good for you to do a PM since the parents are still alive and they should probably give back to another puppy some other time. So you'll be able to rule out some things there. By doing the PM, you won't bill them for it. So that would encourage them to release the dog for you. And then you promise that you will give it a befitting burial. Of course, if you do a PM, you know that the dog is not going to be intact. So you need to let them know so you don't have to face problems with them. So once they say they don't mind, you just open up to see one or two things. And that will help you rule out the fact that there's a stressor in that house that is making the puppy cry all night, all day, or there is a problem internally which you cannot do. Or since he's already dead, but sometimes you want to do an X-ray when he's still alive, haven't done physiological examination, not seeing anything, not being able to put your finger on anything. You want to do palpation of the system and you can't put your hands on anything. And you want to go ahead and do an X-ray or ultrasound or something, whatever you can lay your hands on. At this point, the owners might still be ready to pay for that. All right. So what that tells you, it's really to your own advantage. So you're able to pick up one or two things at that time. So this time that you're just wondering what is it that you could have done to do that, would not that question will not come up. So by the time you go through all of that, you would have been able to say, okay, this is probably what went wrong with the dog.
okay. Thank you so
Yeah,
much.
that would have also informed the line of treatment to give.
Okay. Thank you.
You're welcome, ma'am.
Well, Dr. Ebere, you will need to send your email so that the Society for the Study of Pain can send you a consultation invoice so that you cannot so but because the president is online, so I know that we'll give you a waiver since you joined us on so the only thing we'll ask you to do is to join the Society for the Study of Pain so that you can have more of this. And it's a multidisciplinary society. Today, we've spoken about opioids, even animal pain management, and that tells you that knowledge is multifaceted. And here we are today learning that you just like in human, I was looking at the pain transmission, the transduction, transmission, modulation, perception, the same thing as in human. And when I wanted to say that, I just remember that man too is called an animal. And throughout Professor Shigabi's presentation, all I've been hearing is these guys. And I kept looking at it and said, who are these guys? I say animal, no, the guys. So animal can be guys.
Oh yeah. Sorry, man, that's my word.
We veterinarian, animals are guys. So we appreciate you. Thank you very much.
Thank you very much for inviting me.
Before it's a wonderful. It was wonderfully presented, and the interaction even after the presentation the interactions were wonderful. I will yield the mic to the president, and before then, I quickly want to let everyone know that this is the Society for the Study of Pain. I believe it's the largest multidisciplinary society in Nigeria, and we have people from basic medical sciences, basic clinical sciences. We have people from anatomy, physiology. Nurses are here, physiotherapists, medical doctors, physicians, anesthetists. Everyone is here. And that's why we encourage everyone to join. Membership fee is 10,000 naira. Annual fee is 10,000 naira. And it's best to do it. This is the beginning of the year. Just with 20,000 naira, you join us and you are a member. And for those members that are members already, it's just 10,000 naira for the renewal of the membership for this year. Mr. President, sir, please take over, sir.
Oh, thank you, Professor Gaby. Pardon us if we are not calling your name very well, but we want to really appreciate you for the very interesting lecture. Some of my questions were actually asked, especially that has to do with addiction. That's a big problem with human patients, and you actually addressed that appropriately. And I think another question too that also bothered me and is bothering the society too is the availability and use of opioid. And in fact, that is what even drove us to asking you to come and present, because we have crisis in using opioid for human patients. Physicians are afraid of addiction, so the opioid get are kept and never get used, kind of, and then the patients suffer. So, but now it's even intriguing to know that even your opioid that you get, you still get it from physicians or from those who take care of human patients. So it's kind of a complication to all our thoughts. But we do want to believe that as a society, we have championed the use of opioid in Nigeria. I've collaborated with external bodies in the past, and we will try as much as possible to see what we can do to make sure that the human patients are able to enjoy the use of these class of analgesics. We are built to attend a conference, a meeting soon, and the preliminary training we have received shows that we should use opioid without so much fear. If it is necessary, it should be used as much as possible for the human patients. So we want to really appreciate your insightful lecture. It has opened up a lot of dialogue, and we'll continue to think about it. I want to also appreciate my immediate past president, Professor Akinpelu, who is also here, the VP1, Dr. Ayo, the VP2, Dr. Lateju, Professor Dolly, our auditor. Dr. Lateju has been the secretary, and Professor Elizabeth Ogboli Nwaso. Thank you for always joining. Many of these people are not in Nigeria. Dr. Akinwale, I can see you. And other professors, Professor Akinrimade. We want to appreciate every one of us that have found time to join this webinar. Please let us know that the SSPN is a multidisciplinary society. Dr. Wumi Oguntoye is a veterinarian and has presented before. When she also presented, it was like, we were also surprised to hear what she had to say about surgery and what have we. So, and everybody that brings in their own area of expertise always excite us, including the nurses, physiotherapists. So that makes the society so interesting. And I encourage everyone who has found time to attend here to also become a member. Every month we have one lecture or the other from different sector or among those who are involved in either pain research or management. We should at some point get to policy, maybe government, governmental institutions, NGO. I believe that we are going to get there. So I want to thank every one of us for this beautiful webinar and say good evening to every one of us. Thank you very much.
Thank you very much, sir.
Thank you. Good night, everyone. Bye-bye.
Bye.
Bye. Bye-bye. Good night.
Bye.
Lovely
Mute.
night rest.
Nice.
Yes,
Good night.
the Ilori people.